Hey everyone, welcome to Dental Voice with Xyrus. My name is Rolando Mia, and I am here with Dr. Marc Liechtung. Dental Voice is about hearing from professionals and getting meaningful, real information. Dr. Marc Liechtung is an expert and is sharing some incredible things with us. Last week, he shared, think about this, financials. Two practices generating $3.6 million each, one worth $10 million, one worth two. If you want to find out the details behind that, check out that episode. In this episode, 2 of 4, what Dr. Marc Liechtung is going to share with us is why dental hygiene is so critical and one of the most underappreciated or untapped functions in a dental practice. Good afternoon, Dr. Marc, and thank you so much for joining us. As usual, you look absolutely wonderful. Really
Thank you,
appreciate you
Ro.
taking the time.
Coming from you, that means whatever.
Something.
But, I love you. It's great to be back. And, we got to get started because we've got a lot to cover. This is
All
an
right, go for it.
exciting
Talk
topic.
to us.
I got to tell you, coming out of last week, which was just really exciting about the numbers and the different practices, there is no doubt if your practice isn't running at a 28 to 30% top line revenue of being hygiene of your total gross, you have a lot left on the table. And really, that's what it's all about. Today, we want to discuss how hygienists run the practice in the sense of their own practice within their chair. They really are instrumental, but also growing what we talk about, EBITDA, getting the best number from the best group out there. As executive director at Guardian, I know what we're looking for. I know hygiene brings the EBITDA up. It's a very big discussion, whether you put an associate in. We're going to cover a lot of ground. But clearly, today we want to learn that the absolute optimum practices have a well-run, higher than 30% of their gross revenue is due to the hygiene department.
So let me ask you a quick question. We hear often, why is there such a disconnect in a dental practice between the value of dental hygiene and its role in the dental practice? Just quickly before we get into the detail,
Right.
why there seems to
Well,
be
if you
friction
go by
around
the bare fact of a chair and you look at a chair value, an hour a chair, you have a doctor associate that could be doing a crown, and you have a hygienist that could be doing a cleaning, right? Just scraping teeth. But there's so much more to that hygiene visit. But it also entails around the team, around the office. The hygienist is the liaison between not only the staff and the doctor, the team and the doctor, by telling them, we could do better in x-ray taking this, but get involved. But also when you have disgruntled patients or a patient that is happy and wants to do more treatment, that hygienist could be the liaison between the doctor and the patient. A lot of value there in that 1 hour. Plus, remember, that top line production is exciting.
So it's something. What can you share with people to make them understand or realize, holy cow, I am underutilizing my dental hygiene, and then what advice would you give people to figure out how to bring it back up, and then also support the dental hygiene function?
Right. Today in the hygiene world, there is so much more than just cleaning teeth. Our hygienists should be trained in different aspects of dentistry. And that's the investment the office has to make between tooth whitening, arrestin, irrigation, fluoride treatments, and of course, scaling and root planing. The $150 cleaning in an hour could be a $400 visit if you're looking from an economical standpoint. From a standpoint of what better profession, I always say, is dentistry, that we recall our customers. And the hygiene department, when it's full, is literally recalling customers, patients that need more treatment. And if we don't have a strong, robust hygiene department, we might as well market all we want, but we're missing out on the simplest, easiest, best way of marketing, and that's recalling our existing customers, our existing loving patients. That's where hygiene becomes a separator of practices. A well-run hygiene department, 2 hygienists going or more, going all the time. That practice is flourishing because it's constant flow of patients needing treatment. And that really is why I think when we look at a practice and we see a poor hygiene program, I can bet you that EBITDA, that drop dead operational profit, is not as good as somebody who has 2 hygienists, 3 hygienists going with a constant full schedule, room for new patients, and having scaling and root planings and fluoride treatments and Arrestin mixed into their week. That's
So
an
is it
exciting issue.
so is it about making sure that your hygienists are constantly working? Is that what you're saying?
I'm not saying that. I'm
What
saying
are
there's
you?
so many aspects to hygiene that it's obviously not going to be covered on a talk for 30 minutes, because I believe a hygienist that is worth, they are, they are worth their value. They are, because if a patient is disgruntled about the weight, patient's disgruntled about something that happened previously, they're coming in for the cleaning, their hygiene visit. They come in and they see, hi, Chris. Hey, Pat, how are you? Thank you. And I love that. I love when a patient is calling their hygienist by their first name. What a connection, because that's the connection we have established with this practice, that they know our hygienist by their first name. And they come in for that. And then they sit down and they turn to Pat and they say, Pat, I must tell you, the last time I came in, the young associate saw me, and I still have a little bit of a sensitivity. I'm a little concerned. And Pat's there to say, Mary, please don't worry. We'll take a look. Dr. Smith is excellent. And we're going to see what's the problem, if there is a problem. Maybe it's just a small little adjustment. But without Pat, that patient is complaining to the doctor or maybe to somebody else. And I think the hygienists have such a role in both clinical and both administrative, because they have that reverence from the team and trust from the doctor. And don't get me wrong, when a patient is being evaluated in the treatment plan for a treatment plan, I'm of the belief that my hygienists, our hygienists, plant that seed. Plant that seed. Because how bad do they look if a doctor walks in and says, tooth number 30 has a big hole in it? Why didn't Pat see it? So of the school that I don't like to have my hygienists tell patients what they need, they don't tell them what they need. Everything needs to be confirmed with the doctor. But they certainly mention blatant pathology that they know, because as the trust of the tandem of the doctor and the hygienist grows, treatment plans, case acceptance goes through the roof.
So wait, hold on. Before
Yep.
you
I
go forward.
have spit out so much stuff.
But this is really important.
Yes.
It's not about, and you just hit on a very, very critical point that we've heard. Doctors are saying, hold on, you're not a dentist. Don't give your patient. But the connections you made, which is blatant pathology, there's a big hole in there. It's okay. And I think that's a really key point that needs to be made, that by, I guess, working with your hygienist and giving them the mentoring and the support to be able to share that with you and the patient, that changes everything. Did I get that right?
It does. And another thing also is, if you're in a cosmopolitan city, I grew up in New York. I practiced in New York. If you can't tell, this is
New York? What are you talking about?
But and it's not being proud of the accent. It just is the accent.
No, it's awesome.
I guess it is what it is. But in that city, I know my new patient that's coming to see me, and this is an amazing. I think about this. I never shared it, and I must tell you, I know that the new patient that's coming to see me, last time, maybe the time before, they saw a hygienist. Now they're coming in to see a doctor without a hygiene program. Kind of weird. I'm used to seeing a hygienist. The doctor's looking too closely. Who knows what they're thinking? But I do believe hygiene separates the practices. I've never practiced without a 1, 2, 3, but I do believe that they add so much more. What it is control, quality, and definitely acceptance of treatment, which is why, listen, I know of a great practice. I mentioned it maybe last week, but very little hygiene, tremendous production. It's a specialty practice. They don't recall their patients. They advertise for their patients. So their advertisement is huge. But for us GP, multi-specialty GP practices, general practices, I believe that the best form is of marketing and reviews is a full hygiene book. Because if my hygiene books are full, I know my patients, not all new patients, are happy and coming back to be seen by our office. If I see the hygienist book empty, I'd be concerned, even if the doctor's book is full. Because what is going on? What is happening at hygiene, right, Ro? Think about it. You come
Right,
in,
right,
the
right.
hygienist is a little gruff, not explanatory, really doesn't like the practice, angry at some manager. They're not going to win patients over. It's more than numbers because numbers grow. Big factor in my life, it's always been you do the right thing and the numbers come. And I
So wait,
believe,
speaking about
yep,
numbers, can you share, like you did last week, the difference between a high producing and successful dental practice with hygiene and then one who isn't, and what impact that has? Could you
sure.
kind of take us through that?
I'm going to take you through that, but then we're going to take a practice that is trying to grow their hygiene and how simple it is. And we're talking about practices. I go into a lot of practices as we established last week. And the most incredible thing is I could see a practice that says to me, we are booked out for 4 weeks. That's great. And they doing about $800,000 a year in production. I could walk into another office, two hygienists, same as that. We're booked out for 4 weeks. Yet that hygiene department is doing $1 million. That hygiene department is doing $1 million because of the way they systematically have. And by the way, I am an hour proponent. I'm sorry. I know we want to get them in. If you tell me you have 20 minutes for a hygiene appointment, I feel like we're not going to have that book that's booked, or you're accepting insurances that accept that. But if you want to build a quality fee for service, we're talking about a mixture of quality and top line growth and a great lifestyle for dentists that want to make a lot of money. I don't want to make every dime with my own hands. I want to let other people make money for me. The best way in dentistry is having a successful hygiene. How do you do that? The most important is to have, if you can, when you start out, and I talked about this with somebody today, about when a young dentist comes out, I mean, obviously you can't get a hygienist, but you have to do the work yourself. But as quick as you could book a day, 2 days, and grow with that hygienist, your hygiene department will grow because you have somebody that's calling, that's getting people in because they want to save their days. They want to grow with you. It's a tremendous advantage. But take a mature practice. Take a mature practice that we're looking at like we did last week and evaluating it. If I walk into a practice and I see like I mentioned, the doctor's schedule is packed, but hygiene is weak, I can guarantee you that there's a very much less new patients, and the production coming out of hygiene is at a minimum, which means if the doctor is producing so much, that EBITDA calculation, due to we talked about last week about owner's compensation coming off, will be low. But if the hygiene department is strong and we're making revenue from other people other than the owner, your EBITDA will be larger. Therefore, if you're going to sell your practice in the next few years,
There you
your
go.
pay will be much larger with a much stronger hygiene department. Because out of your total gross, your hygiene department is doing a third or more. I see
Right.
offices doing 35-40%. You would say, oh my God, they do no dentistry. No, they do a ton of dentistry. Their revenue is $4, $5, $6 million or three. I'm not only talking about large practices. I seem to be, but you could look at it on a smaller level and take a $600,000 practice. Once you have a full-time hygienist, your revenue grows. Sorry, Ro, I get
No,
into
no,
it.
no.
I
This
get
is
into
really
it.
true. So let me ask you this: when you walk into a dental practice and you see the dentist
Yep.
performing dental hygiene, is that a good thing? Is that a bad thing? Because they're like, no, no, no. I don't have. I can't. I need to do it because I can't afford not to. What are your thoughts on having the
I
dentists
mean, I
performing dental
come
hygiene?
at it from different angles. I mean, from a professional I think every dentist that's providing as good a care as they could, and if they cannot, because of the structure, the neighborhood, the socioeconomic level, they're providing dentistry. They just can't have a 60, 55, $50 an hour employee that stands on ground on those numbers. Then I respect it, but know full well that if we started this conversation 2 weeks ago and talking about how you could sell your practice will not be as valued, not have the same level of return as a practice that is in a different area with a robust hygiene department. So when I look at somebody that's doing hygiene and there's no hygienist, I tend to think it's going to be a stretch for us or one of the quality groups out there to really entertain a deal, because it's just in my mind the EBITDA will be low.
So
Now,
it's okay to have a dentist perform dental hygiene, but the issue is dentists have the ability to produce much higher production, and it makes sense to build and nurture a viable dental hygiene program. That's what
see,
I'm hearing.
at the beginning of our careers, and as we grew, and if we lost a hygienist during the pandemic, there's a saying, right? We live with it. You got to do what you got to do. And
Right.
if a dentist got to pull up a chair and take a scaler and start cleaning teeth, you do it.
Right.
But if you're asking me for the ideal, obviously it's not. Do I look down at a dentist that's cleaning teeth? No. But I'm going to ask the dentist, how do you feel about cleaning teeth? I mean, we're talking, my goal of talking to dentists and young dentists, I want to say this, is I love the profession. I do. It's been great to me. It's been great to a lot of people around me. It makes sense to me. And I got to say that when I see a dentist, I'm going to say, if it's your path, that's what you want to do, that's the way you want to go, great. But if you want something else, don't stop. You clean teeth until restorative is larger than what you've got to do, and you're not giving your patients just due the time that it needs. Because honestly, I have a lot of experience. At my peak, I wouldn't be a good hygienist. So
No.
I think there's a whole business, and I think now's a great time, if I could. I brought something today, a little narrative to show people exactly what the situation is and how a business listen, we talk hygiene, but I think the entire team is valuable. It's a good time to talk about dental assistants and how they greet a patient and how they can help when a doctor's doing an exam on talking about the doctor, the practice, the procedure. But hygienists, that is where you are semi of a provider and semi of a team member. And when you sit with a patient, you tell a patient how we're going to resolve this matter, and don't worry about the root canal that they need or the veneers that they're thinking of getting. It's going to be beautiful. That's the separation. And the hygienist really has that ability to be that liaison to increase the revenue stream of this practice. And it is about quality. It is about, growing the team with the confidence and the panache of having great hygienists, but it's also rounding everyone in, being a great team, and really working with the doctors hand in hand. And I believe to doctors, if you don't feel you have a hygienist that you're working with in that way, we're paying a lot of money. Hygienists really need to understand on their end that we are paying a lot of money for their services. We have a lot of respect. They have a lot to do. And we want them to be a team player, not above anyone, not below anyone, walk on our sides and be a team player. I think I've been blessed. I've been blessed with great hygienists. And
I love the message, and
yeah.
I love the context around that very much. Very, very much appreciate the context around that.
Right.
Share with us some numbers. What does this look like?
Fantastic. So, recently I evaluated a practice and how we can grow from 1 year to another year. And we do these just evaluations of different practices, of different things. So if we could pull up a graphic that I brought, all right, in the next, little bit of time, 10 minutes, I wanted to bring this up and show people what I am talking about. What we're saying here is that this is a double hygiene practice, full-time hygiene, right? So we have a total of about 10 to 12 days of hygiene. We'll go with the 10 days. And what I've evaluated here is if we go on the top, it's the top part of this graph is really explaining the procedure numbers that I expect to grow. And why do we expect to grow these numbers in the hygiene chair? And let's see what these procedures are. First of all, it's scaling and root planing, arrestin, fluoride, and irrigation. Everything that helps an adult patient keep their teeth healthy, their gums emulsified and clean, and their gums healthy from any pocketing and future gum disease, right? So that's what it shows on the top. On the bottom, it's a comparison of a plan that we're going to go from year 1 to year 2. Now, the reason we can go with those numbers is because we've instituted in this graphic, and this is a graphic only, obviously, is just something called every patient must get probed. Every patient must get evaluated from that standpoint. With that hour, we should be able to probe. By probing, we find an increase in the need for arrestin. By looking at the teeth and seeing people getting older and more desiccated, more open to decay, we put a fluoride treatment in. Irrigation of the gums, but pre and post scaling and root planing. Very important to keep the gums and the pockets clean. And scaling and root planing. Any office and hygiene department must have hygiene, and hygiene gurus must have hygienists that are willing to go and clean and scrape the roots and prevent gum disease. So we're keeping our patients from the periodontist. There are enough things to diagnose, and we can help our patients stay out of the periodontal chair. When needed, they go. But when not needed, our hygienists can clean up 4, 5, and 6 millimeter pockets. And I'm a big proponent. I went to University of Pennsylvania, which is hugely involved with perio, as many know that went there. But I am also, not just from a revenue standpoint, but from a health standpoint. You know, in our world, we're probably going to lose teeth from gum disease more or less than decay, much more than decay. So I think that's our situation. Now, if you look at this graph, in year 1, right, they produced $92,000, almost $93,000 with these procedures. I want to take a given. A given is that this is a $3 million practice. A given is that they have see about between 300 and 3,300 patients for hygiene. So it's about 3,200 patients come in for hygiene at about $225 all in. Okay, it's in a nice area, not an area that's very, very high priced practice, but in where it is with all in $225 for a pro fee. You can gauge your area the way it is. This is a graph I want to present. And what I do is this way. If you take the increases that we're going to do with arrestin, and I can tell you month 1 of a practice, they have exploded with arrestin. Understanding the concept of probing is very important to teach new hygienists. But if you look at the increase in revenue of, right, so we went for an $8,000 increase. That's almost pure profit and pure need for the patient. But if you go down to scaling and root planing and you literally probe teeth, we are only talking about we are talking about 6 total, 6 per hygienist per week. That's less than 1.5 a day. Yeah. It's 1.25 a day. When you probe and you find that in a mouth, scheduling that 1 quadrant more a day changes the dynamic of a practice, but also changes the health of a patient. You've increased the revenue to a total of $181,000, other than the $720,000 that hygiene has developed from their room. Therefore, it's a total of exactly 30% of a $3 million practice. When you have an associate in the operatory doing dentistry, number one, some doctors are not very comfortable with associates. So they're over their shoulder, making for a possibility of a revolving door episode, which is not healthy for the patients. Not healthy for practice.
Yeah, so wait, hold on. So, and I love the kind of the structure. Quick question. Is this When you look at this type of practice, is this typical? Is it a big practice, middle, or a small practice?
This is a practice that will have, if you ask me, close to something of $1 million, million one of EBITDA, because the revenue isn't coming from the owner who's scraping teeth or doing all the work. The work is coming from one associate, two hygienists, and the owner. So the
So
owner
it's
works.
balanced.
It's balanced. And by having a balanced attack, it's like what we're up against. Football. You have a specialty, you have offense, you have defense. If you're balanced, you're going to win the Super Bowl. You cannot go in just doing dentistry by
Yeah,
yourself.
the dentist
So if
is
you
going to
look
do
at this,
everything.
$3 million practice, and every day you're making money from hygiene. You have $1 million practice almost in hygiene. And by the way, 30% is conservative in some practice.
Yeah, so the other thing too, I'm noticing, it's not just about the revenue. It's not just about the production. And I love the context that in addition to that, you're also increasing your standard of care. You're increasing the health of your patients. And I don't want that to get lost and make it sound like, this is all about the money. This is about being there for your patient, establishing it. You know what I think, what's also cool, you share this with your team, correct?
Absolutely. And I would like to add, like I said last week, and I'll say it again, you do not have a quality practice if you're busy redoing your treatment. You do not have a quality practice if your hygienists are not scaling and root planing, are not placing the technology that we have in the industry, like antibiotic. So there are so many things that help our patients that we're lucky enough to make a living. And I'll leave it with this, and I know we're getting late, but I'll say, remember, hygiene. We recall our patients. We recall our customers. How good is that? So I hope this was just a little overview. There's so much to talk about. I know that we're running out of time, but I love these things. I could talk forever about dentistry.
Wait, passion? What, are you kidding me?
Passion,
No way.
passion,
New York? What are you talking about?
passion. I got to tell you, Ro, now could I say, I want to say thank you to Xyrus, because from the Hirsch's on up and down, it's a quality company. We use it in our offices. I'm not just, there's not a commercial. I want to just say to them, they're such nice people and they care so much about the industry. And what this guy to my right or left is doing is phenomenal. He's just taking this thing and really educating people. And I can't thank him enough. And I want to I know we're running out of time, but if you take the first and the second, next week, we're going to talk about a doctor and how good that doctor needs to be to become a superstar and what they need in their armamentarium. I'm excited.
Well, let me show you something. Wait, hold on. Go ahead and read that. Our CEO.
Great insight, Dr. Liechtung. Hygienists are who we see most. A great patient experience is the best way to market. Not only is the patient be back, they will tell their friend 100%. 100%. But we do that in every aspect, from the phone to the dismissal. We must be an amazing team. And the hygienists are a very important cog in that wheel.
No, so first of all, yes, there is so much that you could share. And I love the energy. I love the passion. I love your willingness to really just basically lay it out. And it's not about making trying to do something. It's about being clear about what needs to be done. Folks, Dr. Marc Liechtung is going to be covering 2 additional episodes with us. If you haven't seen his first episode with us where he takes us through the financials metrics, take a second to do that. Take this. If you like this content, share it. Join us next week on Thursday. And what he's going to focus on is a term, the 5 most important procedures that are in dental practice. And there's a term that he calls it the humps, and we'll cover that then. If people had questions for you, Dr. Liechtung, what would be the best way to get to you?
I'd love you to email me on the bottom, mliechtung@gmail. This way you go right to me. I'm really excited about hearing the way I heard last week. I'm happy it resonated. I think there's so much in dentistry that we all want to share. And I always say, learn from the best and share with the rest. Some of us have been in this field for a long time, and we have a lot to offer. And you take what's valued to you. Every practice is different. It's so exciting. But I got to tell you, we all should be so excited about the future, whatever stage we're at in dentistry. Very
No, I love
blessed.
it. I love it. And then if people wanted to find information about Guardian, what was the best way to get them?
Yeah, GDP, Guardian Dentistry Partners. Please look us up. It's a phenomenal group. It values dentists. It really does. I've been with them for 2 years, and one day we should talk about why I went through. I sold to 3 different DSOs, and talk about why I think Guardian is so special. And everything I mentioned today about that is like-minded Guardian
Awesome.
operational people. But I know we're running out of time, but we really should spend 5 minutes, and we will. Thank you, everybody.
Hey, thank you, sir. Hey, everyone, if you like this video, come join us next week, same time, Thursday at 3 o'clock Eastern, 12 o'clock Pacific time. Dr. Liechtung, thank you so much for joining us, and we look forward to hearing more from you. Have a wonderful, wonderful day, and appreciate it.